All right, folks. Well, I'm going to call to order the, December meeting for the LADPC, and I appreciate everybody's flexibility with scheduling. We called this meeting pretty close to the holiday season for a lot of us, but a lot of us aren't traveling, so we get to attend this meeting. We meet monthly to discuss different concerns and issues around alcohol and drug concerns for our community. And we were really feeling the need to pull together some conversations and a place to talk about Measure 110 and what that means for not just the state of Oregon, but Jackson County as well. So today we're very lucky to have some speakers with us. Steve Allen, the Director of Behavioral Health from the Oregon Health Authority is here. Joe Ferguson, the Deputy Director of Juvenile Services for Jackson County is here. Lori Paris from the ARC, who's participating in the implementation team statewide. Is that correct, Lori? I don't want to misrepresent that.
It's the Health Justice Recovery Alliance was formed out of the group that pushed Measure 110, and we're acting in an advisory capacity to OHA.
So we'll get to hear from them. And we also have our District Attorney, Beth Heckert, here to talk about how this is going to transform the way we prosecute different crimes within our community and what that looks like. I feel there's a need probably at our next meeting to get some speakers who have lived experience in Jackson County about what their thoughts are, to hear from some frontline providers about what they anticipate in the work they do, and to maybe look at some of the different ways that this is going to interface with our community as Oregon at this point goes down this bold new path. So first on our agenda is approval of minutes and roundtable introductions. I'd actually like to pause that, and we'll do that piece of work afterward. However, before we start and before we kick it over to our panel, Commissioner Bob Strosser is with us for the last official meeting that he will join us, although I suspect we will be seeing him around occasionally as we continue to do this work. And I want to just give him my heartfelt thanks and gratitude. Some of the best discussions we've had in our community have been in this room due to the fact that under Commissioner Strosser's leadership, the way we work with people with substance use disorder, the way our community comes together, it really took a priority in terms of how he put things forth. When Jackson County declared substance use disorder a public health emergency, it was Commissioner Strosser's leadership that brought us together to make sure that it was verbalized in a way that reflected our community. And as he brought that forth to the community, it's really set the tone that people living with substance use disorder are worth investing in, and that the work is indeed noble and in need of service. So, Commissioner, I'm so grateful for the leadership you've provided, and I'd like to give you a minute to speak to the group, if you wouldn't mind.
Well, the last time you did an introduction for me, I seem to recall the only line I could follow with when you edified some of my prior background was say, he's trying to say I'm old. This one, it was a little kinder to me, but probably a little gratuitous as well, because the thanks for all of those things really rests with many of the people in this room. And to facilitate it is far different than living it and doing it. So I would just tell you that I will miss being on the Board of Commissioners. My wife retired and decided that we should spend more time together. And I thought that was probably a really good idea. So that resulted in the decision. So it's been a great time here for the last number of years. And probably the one thing that I would walk away from feeling really good about is looking at this committee and looking at the people that are working in the system now and how they're trying to do things, and knowing that things were going in the right direction. So we have some interesting things and challenges, I'm sure, that, will be dealt with and all that, but we also have very good people that are working on them. So that's it for me, and thank you very much for the kind words.
Much appreciated, Commissioner. Thank you so much for your time.
I see you, Brandon. I saw that.
So today we're lucky enough to have all of the folks here. You look around our room, we've got physicians, we have a chief of police, we have our district attorney, we have people that are leaders within different elements of our recovery and treatment community. And so I'm just, again, I just am kind of marveled at what this room brings together. And so when I get to introduce the Oregon Health Authority's Director of Behavioral Health, Steve Allen, to this group, it excites me because Steve has been very committed to being local in his work, which is really hard to do the more you get pulled into Salem. But as he's continued to visit our community, connect within our community, I'm just always grateful at his availability and his understanding that no matter what happens in Salem, we all live it in our communities. And so, Steve, thank you again for spending some time with us today as we kind of go down this bold new path. And I really want to give you the floor first because I know your time, you are getting pulled some other directions, particularly these days. So thanks for your time today.
Thanks so much, Eric, and really appreciate this opportunity to get in front of you to talk about Measure 110, see some familiar faces, Stacy and you, Eric, from prior projects we're working on. Cynthia, you had to endure me earlier this morning in a meeting that we're working on other parts of the substance use disorder system. But I also just want to let you know, our heart goes out to you in Jackson County, being one of the harder hit counties and your communities. Both the pandemic and the fire season have been brutal this year, and you've gone through so much. Also know from prior visits that Jackson County has really struggled with people with mental illness and addiction and homelessness. And so, I can understand, like the rest of folks in Oregon, along with this measure comes some understandable concerns about the shift in approach to people with serious addictions and hard drugs, and will that have ripples, into our younger people, into the schools, et cetera, and what will this mean for the long run? But regardless of what we all thought about it, it's been passed. I frankly, from a prior work with the Council of State Governments, know that, and I think as you do as well, punishment doesn't do much to turn around addictions. It does sometimes give a foothold into bringing people into services, but I think there's more than one way to do that. I think we can also attract people into services to sustain them. And as I talk a little bit about what we're thinking on the front end of this, I think to share some of the values and approaches that we think would make this measure an opportunity to really shift some of the ways that we work together and provide potentially some additional funding that's much needed in the addiction system here in Oregon. So where are we? So this measure, I think, as everyone knows, decriminalizes minor possession. About 4,000 people in 2019 were affected by this. There's a disproportionality with blacks being caught up in this at twice the level. But we're looking beyond just the immediate impacts of this, but am also anxious to hear from the district attorney, the courts, law enforcement about how you perceive this, what your concerns are, and frankly, what you think an array of services would be that would truly help support the individuals affected by this so that they're not caught up in the revolving door of arrests and jail and treatment, et cetera. So what can we do together to support each other in doing this work? The measure decriminalizes, as I mentioned, it moves marijuana money from where it's been, chunks of it, to a special fund to help support this work. That includes creating a temporary hole in OHA that I've been assured will be backfilled. How the money will flow, when it'll flow, I think is all up in the air. The governor needs to weigh in, the legislature needs to weigh in about how this will be distributed. But there are a few things that are coming at us pretty fast. One of those is standing up an oversight council that will help shape the services. Is currently designed to authorize grants that would go to local communities. We're busy recruiting for that. There's a website now on the OHA website where you can provide input. You can also volunteer to be part of that council. So we're looking for people to help inform this, and I've already been in a number of different meetings by a number of different groups who have a strong interest in this work and are eager to help shape it in ways that they think would be most beneficial for people in Oregon. The second is to stand up a temporary crisis line where people who are cited for this and have the $100 fine can call in and check in, be assessed, and receive services. That work is moving forward. We think Lines for Life is a logical place to put that initially, at least, because of the other book of business that they're doing for us right now. So that makes an easy transition. And then beyond that, those two things then is the beginning to design the services and begin to look at what's termed an addiction recovery center that would be part of a regional array. I think in my mind, there's lots of flexibility on how to build that. It doesn't necessarily have to be the same thing in the same place around the state, which is where I think we need a lot of regional input on what that ought to look like. Eastern Oregon, for instance, may look very different from the coast or from the I-5 corridor. So looking for input on what would work best in your community as we begin to build out these services. A mantra that you've heard from me as we try to develop services throughout our behavioral health system to be more of a system and less fragmented is the word simple, responsive, and meaningful. Simple is about simplicity of access to services people need. Responsive is about being responsive to who people are, what they need. That includes their age, their gender, their race, other conditions that they may have. All of that is critically important to be responsive to, and I'll get back to that. And the last piece, the most important piece, is that whatever we're providing leads to meaningful improvements in people's lives. So we're not just checking a box. We're not just talking to people, that we're engaging folks with addiction and mental illness and services that actually shift the arc of those conditions and help them live the kind of lives and be in recovery that they would hope for themselves and we would hope for as their community. I think while the measure doesn't speak to this, so as part of that approach, we think that we don't do enough in the area of co-occurring services. So many of these people who would likely be cited are also people who may have an addiction at some level, but may also have a mental illness, may have dental health problems, may have primary care, physical health challenges. And I'd like us to have a dialogue about, as people reach out, that we have an array of services that we can deliver and that we engage with the CCOs, we engage with our CMHPs. And so we have a lot to offer that we hope can further engage these individuals. And that we, as we design this, as I said earlier, work closely with law enforcement, the courts, the DAs, and how we stand this up in a way that makes sense for individuals as well as communities. So don't think that all of this work is busy being designed already. This is mostly just in Steve's head at the moment, although it quickly needs to move, out of my head and out of other people's heads and into a cohesive plan. What we've been doing so far is standing up the internal infrastructure that we need to support this work. And so as we bring together the oversight body and others who wish to help shape and influence this, that we have the people around the table who can help capture, create plans, and begin to move this down the road as we need it. In the way that I'm imagining it, it's more complicated than the way that it's laid out in the measure, but I want us to have a really robust conversation about doing this right, doing it in a way that will actually improve lives along the way. So that's a quick overview of kind of what's in my head. Would welcome input from others or questions if you have them. I do have a hard stop at 3:30 House Behavioral Health is meeting then.
Steve, just a quick question. I read so many different little pieces here and there, but I seem to have read something that said one of the ways or one of the prioritized service methods is going to be utilizing peers and people with lived experience to do outreach and connection work. Can you speak to that at all, or?
Yeah, that is part of the intent of the measure, is to lean heavily into our peer support services, and I think that's a really good idea. I think a part of what's imagined is the first call goes to a peer and work on engagement and an initial assessment of social service needs, not just addiction needs, and then do the warm handoff to a trained clinician who can assess, what level of addiction or other conditions that person may have. We have included peer support services in our SUD waiver with CMS. We're still in negotiation with CMS around the peer services funding, and so that appears that part of the waiver will be delayed a little bit, so Medicaid funding won't immediately be expanded for peer services for Medicaid, but we'll stay in negotiation with CMS around that.
Other questions? We're going to hear from our juvenile director here a little later, but I was wondering if there's been talk around adolescent health as it pertains to what the implications of this could be.
Yeah, I've been hearing some pretty strong concerns about the potential for this impacting kids. I think the thinking goes that if we decriminalize these drugs, will they become more accessible to kids? And if kids start early and on these hard drugs, it's hard not to imagine bad things happening over the course of the time. These are very powerful drugs that are now available, and it's not like the drugs in the past that you may need to have your risk of addiction had at least some connection to your biology or genetic predisposition. Here, the drugs now are so powerful that they can literally reshape and create an addiction in people that may not have been at risk for that before. And I'm thinking specifically about the really powerful opioids that are now out there, fentanyl especially, but meth is now often laced with these opioids. And so there's really high levels of risk for that. So I think we have to think broadly beyond just adults.
I think you got accidentally muted there towards the end after have to think broadly beyond just adult. So.
Oh, yeah, sorry.
Okay.
Not sure how that happened. Yeah, just thinking beyond adults and thinking about the risk for kids and to ensure that whatever array of services and outreach that we have includes kids.
And so while we've got you for one more minute, I'll monopolize all the questions. So just logistically, and I know we're still figuring this out, but we've got Chief Clausen, who's Medford's chief of police. And if one of his officers issues somebody a ticket, confiscates the unlawful narcotic, I don't know what we'll call it, confiscates the item, what are the accountability measures? Not just like, hey, how do we make sure they do it, but are there pieces in place to ensure follow through? And yet still, if we're treating this really truly like a health concern, protect the person's privacy? Like, how does that all kind of play out and when this goes forward?
That's really hard questions, Eric. They're really good questions. So I've been getting the same types of questions, and I think that's where we really need to bring law enforcement in. So we're looking at a meeting with law enforcement, the DAs, the courts in early January to ask these very types of questions, because there is an accountability piece. People get cited and they have an opportunity to resolve that $100 fine that they would get, but it requires them to do that outreach. And so what is the system that we're going to put in place to alert law enforcement that that's been taken care of? So there's this kind of cycle of communication that has yet to be worked out, and I'm not sure that this can be done on a statewide basis. That would be really convenient. My guess is that there have to be some local initiatives to ensure that communication goes around. That accountability is and privacy, those will be really interesting questions to resolve. So again, our hope is to work on engagement. I think that's the opportunity that this measure allows, and to figure out how to make that engagement and to really help communities address this issue. I think the risk is if the communities and law enforcement, the courts don't believe that this is working, that folks will be charged with something else and they won't come under this measure. I also, as I said earlier, I think I don't want to confine whatever we design for just these people being picked up on possession charges, because that landscape may well change. I think this provides us an opportunity to garner additional flexible funding to promote and design and implement services that are going to help people with addiction and these hard drugs who may or may not come to us through law enforcement contact.
And our Beth Heckert, our district attorney here, had a question too, I think. Beth?
I think you just kind of touched on it there, Steve. So I was wondering if the model that you're kind of building or they're working on here is expecting law enforcement to feed cases into it, because I don't know that will happen. So that's interesting that there's something else, I guess, where people will get into this new system or be able to access services without being directed there in any way by law enforcement.
Yeah, my hope is if we build it, they will come one way or another. If it comes through this law enforcement shift through the citations, that's great. But we'd like to have these services available for everyone. And something I've been hearing that I think is a really good idea is not to just wait until people come to us, that there be an element of outreach. And I think peers would be a great choice for a provider type to do that work.
Great. Well, Steve, I want to thank you again. Your willingness to come and talk to our county has always been really appreciated, and it speaks to your commitment to this work. And if we do have further conversations, we'll keep you and your team appraised, and they've done a great job of being involved as well. So thank you so much.
Thanks so much, Eric.
Thanks, Steve.
Thanks, Eric. Thanks, everyone. Really appreciate the engagement. Feel free to reach out. We are looking for your ideas. Bye now.
Thanks. All right. So, Lori, I kind of feel like the natural segue might be to your part of this conversation, if you're ready, just in terms of the group you're involved with and the work you're doing, to give us another kind of statewide perspective. And obviously, you know darn well what it could or couldn't look like in our community, or you have an idea about it at least. So if you don't mind, I'd like to kick it over.
Sure. And just keeping in mind what Director Allen was talking about, it's in its very early stages, so there's still a lot to be fleshed out. I serve on the board for the Oregon Council for Behavioral Health, and our board voted to oppose Measure 110. I voted to oppose Measure 110. And we did that based on concerns about a lack of a clear plan and how the funding was set up to flow from other recipients who were already getting that money and then moving it. And so we agreed with the concept of getting people to treatment. Anyone who needs treatment getting there. And but once the measure passed and became the Drug Addiction and Treatment Recovery Act, which is, we have a whole new alphabet soup of acronyms, DATRA, then it became time for people to come together to figure out how to successfully do this, because we all need to make it work now that it's the law. And the group that was pushing Measure 110, the primary group, formed the Health Justice Recovery Alliance, the HJRA, and to their credit, invited people who opposed the measure as well as those who supported it, and to participate in the process. And as I mentioned earlier, we serve in an advisory capacity to Oregon Health Authority. I serve on the Health Services Policy Table and on the Finance Subcommittee. There's a tremendous amount of work to be done. The Oversight and Accountability Council, the OAC, applications for that have opened. There are a number of applications that have already been submitted. And as Director Allen was speaking about, it's important if you have that interest in serving on that, please do apply. I can also send the link to that if that's helpful, Eric, to send to the whole group, but it's also on the OHA website. So the work is in process. There are a number of elements spelled out in the law for service elements that are expected to be part of this effort, with funding administered through a grant application mechanism at OHA to providers who meet certain requirements. So everybody has to apply. There's no funding that's committed or promised to any particular providers or groups, but the door is wide open. So that flexibility that was spoken about earlier is really true. So it's not just the existing substance use disorder and mental health providers. It's also organizations that do housing, that do peer organizations like Reclaiming Lives. Potentially, there's lots. So there's a lot in there, and more information to come. Oregon Health Authority is charged, with an implementation responsibility and also the communications around this going forward. So that's how we'll hear about it as it goes on.
Thanks, Lori. That's. I know it's still new that this is all just kind of folks are, I won't say scrambling, but maybe hustling to get together to get some pieces in place. But does anybody have questions for Lori about this process, or who needs to be involved or who is involved? So, okay. Well, thanks, Lori.
Thanks.
As we kind of talk about some of the law enforcement and community corrections responses, really, I'm only going to talk briefly about community corrections and what that means. Out of the 2,400, pre-COVID, we had about 2,400 people that were on supervision in Jackson County. Some of those people were on supervision because they committed a sex offense.
She was just telling me about
some people were on supervision because they...
Here icon in the upper right that controls that.
Oh, Jennifer, is there our good friends at 5 o'clock marketing? Or there we go. All right. Some people are on because they committed domestic violence, assaults, burglaries. Lots of different crimes can land a person. And then we did have a group of folks that were on supervision solely because of a possession of controlled substance or drug-related charge that did not have anything higher than that on it. And so we had about 400 people that were receiving services through us. I think there was a tendency to look at that and say, of those 400 people, they're just low level. They don't get much, right? And that's not how we supervise folks. If somebody comes in and they're a high risk to recidivate, we're going to do a comprehensive assessment, identify whether or not they deserve or whether they warrant a comprehensive treatment plan and set of conditions, and we kind of work with them that way. So there are a number of folks that we're getting a rather intensive and hearty experience with us that won't be receiving that service. So that changes for us. And then the other thing I wanted to talk about, in addition to these 400 folks that will still be with us, but in the future aren't cases that would come our way, is the fact that our department has invested a lot of money historically in treatment and treatment-related services. Over the past 3 years, we gave about $2.1 million to what we would consider treatment-related programs each year. So we would give about $1 million for a number of those years to a local treatment provider to create access and specific services for justice-involved individuals. We would hire 2 staff internally. So we had about $200,000 worth of monies going to people who were just alcohol and drug service providers out at the transition center for adults. Every year we put about $250,000 into DUI supervision and monitoring. The resource center takes about $300,000, $250,000 per year to run it the way it does. And we have a residential treatment program out at the transition center that's funded through correctional dollars to the tune of about $500,000 a year. So this $2 million worth of investments that we've been putting towards folks to work with SUD for people that are system involved, we're concerned that as the state starts to cut this money away and say, hey, y'all don't have as many people on supervision anymore, we're not going to invest in community corrections, that as they pull this money away, before they can stand up a new system of care, there's going to be a void or a gap in services. So that's kind of part of the plea that we're going to have to our next legislative session is, until we get a new system stood up and ready to respond, we need to try and preserve some of the infrastructure as we transition. So we will see what that looks like. But again, I think that, like Lori said, now that we're on this side of the election, it's no longer oh my goodness, but what is this opportunity? How do we get bold with this? And I have a lot of concern about the health of our residents, but I think that the spirit now of this group and of our community is, what are the next steps going forward, and how can we try and minimize any harm they might be in? So I'm really committed to that piece of it. So that's adult community justice, but I wanted to kind of kick it over to Joe Ferguson to talk about juvenile work. One of the stories we heard was that if a 16-year-old was at a party and they had a wine spritzer or a wine cooler in their hand, there would be a system response where that would be referred to court. That person would have to then engage in some preliminary treatment services, and that MIP would kind of channel a number of different services with some accountability on the back end. But if they threw away that wine cooler and said, no, it's just heroin, they would get $100 a ticket and no call to the parents that we know of yet. So I throw that out there as my cautionary tale, but I know Joe and Beth are working around different responses to what that could look like. But I'll kick that over to you, Joe, to talk about initially.
Sure. So, I think everybody's aware that this measure, youth were not a concept even looking at when this was going through. And so it's really an afterthought now of what will you do with youth. And so, as Eric mentioned, I reached out to Beth. We currently, for violations that could potentially go to immunity court or justice court, we have a waiver in place. So those MIPs of alcohol and marijuana currently all come to the juvenile department. So we can track those. We can be consistent in terms of services. And so we're looking at pretty much the same thing. So in terms of those new violations still coming through one place in terms of juvenile, even though we can't do a whole lot with those. One of the big concerns is a youth could be cited, parents would never know because it goes to municipal court or justice court, or a kid that's on probation. The probation officer may never know because that may never come to us. So that's one way of kind of at least helping us track them and still provide some level of service. We're kind of looking at handling the same as we do with MIPs currently. So we would provide a diversion for the first one. So in lieu of the fine, if they do the health assessment, then we kind of track that. If they continue to come back for other ones, then they would get the fine. The mention that Eric did on the MIP of alcohol, so the youth is cited for MIP of alcohol, and they go to court, it is a automatic license suspension and at least a $350 fine, up to $1,000 fine. If it's marijuana, it's a license suspension and $650 fine, up to $1,000 fine. So they're getting punished more for alcohol and marijuana than they are for a harder drug, and that's concerning in terms of what those drugs could do to kids. On the juvenile side, we do the same thing that the adult side does in terms of risk assessments. We're based on all of our service on the higher risk kids. And so even though a youth may come in on a misdemeanor drug offense currently, they could be high risk. And so we're going to dump a lot of services into that youth. If they're a lower risk kid, then no. Even if we do a risk assessment on those violations, there are no services that, technically we can provide if they aren't willing to participate. And that's one of the things I think concerns us with youth, is that they're not real amenable to treatment. They think that it's fun. And so that takes away one piece of accountability that we had. And we don't, Eric mentioned 400 cases over on the adult side. We currently have about 5 youth on probation for misdemeanor possession. That's not a lot. We don't get a lot of them, but again, that's still 5 kids. And so I think that, going through that piece, it's going to be interesting to see what the numbers are. If we will see more now that it's a less of a consequence for youth or not. Looking back at kind of our data, back 3 years, we had about 21 misdemeanor possession charges 3 years ago. It's dropped to 12 2 years ago, and then this last year it's back up to 18. So we're right around that 18, 20 cases a year. But again, those could be higher risk kids that we provide more services for. We've also partnered with parents in terms of parents placing the youth into a drug and alcohol treatment program while the youth may be on probation. So we can provide some backup for that. But that will all go away with the violations. So, on the statewide level, Oregon Juvenile Departments Directors Association, we have a committee that's being put together in terms of talking about this and kind of what each county around the state's doing and kind of what we've heard. So I was on that earlier before coming onto this one. And so, it's being talked about both locally and at a statewide level still for youth too.
Any questions for Joe about juvenile services, kind of what that looks like? Okay, thanks, Joe. I appreciate that, and correcting my analogy a little bit there, my metaphor a little bit. But Beth, one of the things that I've heard, and it kind of that has crossover into prosecution, is, well, what will this do to drug court? Are there still folks that will benefit from drug court? And what will this do to prison? And my answer, and again, I hope you correct me refine my answer much the way Joe has, but my answer is that, drug court really hasn't been taking cases that are just PCS for quite a while. They're taking cases that are prison eligible. And so that person gets to do drug court in lieu of a prison sentence, and they usually have prison as a consequence should they not be successful in drug court. And then the secondary piece was that, these PCS cases weren't landing people in prison on their own. They didn't have that kind of drive or sentence capability. But I don't want to misspeak on that. So as I kick it over to you, if you could make sure that I'm correct in my answers. But Beth Heckert, our district attorney, thanks.
Thank you. No, you're correct. So around the state, some drug courts might be more affected by this change of legislation than they would be in Jackson County. We, for many, many years, have not seen people go to drug court for a possession of controlled substance. And the only exception for that would be like a professional person who was in danger of losing their license or something. If they were to get a conviction, they would take advantage sometimes of that opportunity. So we had people who we put on conditional discharges, and then if they weren't doing well on conditional discharges, they were transitioned into a drug court. So that avenue, I guess, of getting there is gone. But no one is going to prison for PCSs and has not for a very, very long time under Oregon law, clear back to 95 or longer. So nobody's going to prison on PCSs. And this is a big change, and we'll kind of see. I also wasn't in favor of it, but now that it's the law, we're going to do our best to, abide by it and see where it takes us. I kind of feel a little bit like Oregon's doing a big social experiment with all of our community and our youth, and I don't know that that's a great place to be in, but we're there anyway. So felony cases. So a few years ago, or 2 years ago, the legislature made felony cases misdemeanors. And so we last year, and I don't have a good way of breaking down this number, but last year, or this year, we filed 823 PCS misdemeanor cases and about 970 felony PCS cases. But those weren't standalone, and I didn't have a way of pulling out that number, which is really the population that's going to be affected by this law change. It is not very often when you look at someone's criminal history that you only see possessions. That's just not what people get in trouble for. They might have a few possessions, but they also have a burglary or unauthorized use of a motor vehicle, or they have domestic violence cases, or they have DUIs. They have other stuff. So I think the law change was really intended from the literature, and the way that it was kind of sold was that, you're going to keep people out of the criminal justice system and treat that more as a health issue and not have them be in the criminal justice system. And I don't know that that's going to happen, because most of the people who we find who are addicted and are committing other crimes. So we're still going to see those people. We're still going to prosecute those people. Sometimes I guess like a kind of an unattended consequence of the change of law is, prior to this change of 110, if you had a possession of controlled substance, you could expunge that. You could go through a conditional discharge program and you could not end up with a conviction. You could expunge it after 3 years and get rid of it if that was your only conviction. And what I fear now you're going to have people coming into the criminal justice system with more serious crimes because they didn't get some treatment directed by the criminal justice system for the lesser crimes. But time will tell. So if you come into the criminal justice system with like a burglary in the first degree, you can't expunge that. You're going to have that conviction forever. So sometimes I think the long, not looking at it from a really long-sighted way is a concern. But it's still going to be a crime to possess what was felony quantities are now going to be misdemeanors. So if someone has 2 grams or more of cocaine or methamphetamine, that's going to be a misdemeanor now. So it's not like all possession is just a free-for-all, you can have whatever you want. It's not quite there. 40 or more user units of LSD, if you have 40 or more, it'll be a misdemeanor. If you have 12 grams or more of psilocybin, you have 40 or more pills, tablets, capsules of oxycodone, that'll all be a misdemeanor. So those people we're still going to prosecute. And the other kind of caveat there is when the law changed, making felonies into misdemeanors for PCS, the legislature purposely left funding there for community justice to provide supervision. Because normally for a misdemeanor, there's no supervision. So the crystal ball of what's going to happen in the future, I don't know if we are prosecuting people for having, 40 pills or more of oxycodone, will they be on supervision or will they be on bench probation with no direction to go into treatment? So that's a big question mark. And maybe Eric has a better sense of where that might be in the future. But, when the legislature's looking to save pennies, that's one of the places they're going to say that you can't supervise people just for a misdemeanor. And all of our possession drug offenses are going, if you have the quantity, are going to become misdemeanors. So I don't know the answer to that one, and time will tell. There's also something called a commercial drug offense, which is it's been on the books for a long time. We hardly ever used it because it was very complicated to try to prove. So if you had a smaller quantity than these quantities, but you had drug records and you had packaging material and you had $300 or more, and you had this and you had that, and there's like 6 different factors or 7 different factors. If you had 3 of them, you could charge someone with a commercial drug offense. And like I said, we didn't bother with that because it didn't make any sense, because we had misdemeanor and felony possessions that we could charge people with. So maybe we see an increase in those kind of investigations and people still getting prosecuted under commercial drug offense. I don't know. And then delivery and manufacture of controlled substance still going to be illegal. And of course, we'll see people prosecuted for those. So the change of 110 really took the district attorney's office kind of out of the equation because we don't prosecute any violations. So if someone gets one of these cases, it's not going to be handled by my office. I'm never going to read the reports or see anything about it. So just like if you got a speeding ticket, the police officer, if you pled not guilty at Muni Court or Circuit Court, if you were cited by Oregon State Police or one of those other community courts, you would plead not guilty and the police officer would come in and prove their case. So that's what will happen with these PCSs if people contest them. And again, just like some of those kind of unanswered questions, search and seizure issues is one of the ones that law enforcement's concerned about. Like, how will this impact search and seizure? We went through this once already with marijuana, where marijuana used to be a felony and it became a violation. And so we have some case law that kind of tells us, will you be able to use a drug dog anymore? What will you be able to use them for? Will there be other search and seizure issues? So those are really unanswered questions that we're still kind of working through and probably weren't intended consequences, again, of the change of law. Law enforcement may not, that's why I was curious to hear what Director Allen said, and I was glad to hear it actually, that they're not looking for law enforcement to necessarily funnel these people into the system, because I don't know that that's going to happen. It'll be county by county, police department by police department. But even when criminal charges went from felony to misdemeanor, we saw some law enforcement agencies not pursue them as they did before. And I think that will happen when there are violations. The police agencies will look at it from a liability perspective. They're storing evidence on a case that's not really a criminal case, and all kinds of issues, the time that it takes for an officer to write a citation, go to a violation trial, all those things. And we just may not see police funneling in cases here. It may be more just, ignoring it or crushing a pipe and saying, see you later, that's contraband still. It is illegal, but it's not a crime. So again, that's I have no idea of knowing which way it's going to go. The crime lab has already come out and said they're not going to test. So they're not going to test for violations. It's expensive for them. they have a backlog, so this will clear their backlog, but they're not going to test for violations. But probably because the burden of proof is different in a violation trial than it is in a criminal case, probably a field test is going to be good enough to carry that. But again, we don't know for sure because we never did it before. But we're thinking that that is the kind of the current thought. I really did have a major concern on juveniles and juveniles parents not knowing that their juvenile even got cited. And we are working on that. And that again is going to be county by county. Some counties may change their blanket waiver, which is what we're trying to do. And some counties may not. I know when I was 16, I got a speeding ticket and I never told my parents about it. I just paid the ticket and hoped my dad never found out. And, that is going to happen. I mean, that's human nature. So I think by us making a local change to our blanket waiver, we'll at least be funneling them through the juvenile department. We'll have some good statistics. Like SRO officers are going to be the ones, our school resource officers are going to be the ones who are making those cases with kids when school gets back into session and things are going more back to pre-COVID time.
Can you describe blanket waivers a little bit in terms of what they are and what kind of authority you have with those?
Yeah, so what it is it's a court order. So it's, we would put together a list of what kinds of crimes. The statute allows us to waive traffic and traffic crimes and game crimes or violations to circuit court. So those ones in our blanket waiver, those don't go to juvenile. So if a youth gets a Dewey, for example, that goes to Jackson County Circuit Court. All Deweys in Jackson County go to circuit court. No, so a juvenile doesn't get that handled in juvenile court where they normally would get all of their cases handled. So there's a blanket waiver for specific types of offenses that the court has signed off on and said, yes, that makes sense. We don't have to go through a procedure. We don't have to go through like a remand or something where we would try to remand them into adult court. It just automatically happens. So it happens for traffic offenses. So driving under the influence, a reckless drive, hit and run. Those are all traffic offenses. Driving while suspended. Those automatically get sent to juvenile, or don't get sent to juvenile court and get sent to circuit court. The MIPs could have gone all over the place to all of the different community courts, and they don't. So Medford has their city court that handles a lot of violations. Ashland has one. The county uses the one that's out in Central Point, and a number of the police agencies use that court, justice court. So those cases don't get spread around, they go to juvenile. So it's our hope, and we have to get the court to agree to this, it's our hope that we'll be able to identify the PCSs and say those also will get funneled into juveniles. So if a police officer writes a citation or an SRO officer writes a citation, then it's going to be cited into juvenile court and not cited into all of the other courts. Where then juvenile could make a notification to parents. And that's really the only thing we're going to get out of all of that, and some statistics. Because they're still going to be able to just choose what the law said, pay a $100 fine and say thank you, goodbye, or go to an assessment and have the case be dismissed. So we're not going to get those kids into bigger caseloads or treatment or anything different really with juvenile. We're just going to be able to track them and notify parents. So just a couple other little things that I think are kind of concerning to me, and we'll see. Driving under the influence, I think we could see an uptick in driving under the influence cases because people will feel like it's not as big a deal to drive under the influence of heroin, meth, cocaine, whatever it is. So we'll see how that works out. I don't know. And a lot of this is, kind of the unknown, but we don't know how it's all going to work out. I'm hopeful when I hear folks like Director Allen talk about what's the plan, what's going to be rolled out. I mean, I hope there is more treatment available in our community for folks. I just am not positive people will self-direct to it without the carrot and the stick. But, it's what we have now, so we will see how it works. And I will do anything I can to support it now that is the law. So we'll just kind of move forward with it from there. If anybody has any questions or about anything specific, I'd be happy to try and answer them for you. A lot of it we're still trying to figure out.
Are there any provisions or prohibitions against possession of drugs at a school or within a school, or even mass quantities? Okay.
Possession, there's delivery or manufacture within 1,000 feet of a school, but it didn't apply to possession. So there won't be those provisions either.
And I would just share, and Beth was talking on the adult side, where most of the time there's another criminal matter that comes along with the possession. And I would say that's fairly true for juveniles, but we do have a handful of youth that all we ever get is MIPs. And so, they will rack up 15 MIPs, and there still is nothing we can do other than fine them and do, at that point, a license suspension and a fine are pointless because they haven't paid or taken care of the ones before. So, but we do see some that come along with the criminal matters that we can then also make that a condition of a diversion agreement or probation.
Well, I thank both of you and Lori for being willing to speak to our group today, and we'll continue to kind of bring folks in. I think it is a bold new move for our state and our community. I'm choosing my words carefully. And as we go through this, I think it'll be interesting to see if more people are getting help or not. So continuing those conversations with our CCOs to try and identify some baselines for how many folks were we seeing that tried to engage in services, and did we increase that when we started to infuse different service provisions, or did it go down when people felt there weren't long-term consequences in their life due to prolonged use? Is there that balance? Can we identify? Lori, yeah.
So one of the provisions in the law is with the funding, that some of the funding will cover treatment. And so it won't be going, in that case, through a CCO. It will not be going through a billing process, which makes it really important that we have data tracking for this entire new system. Otherwise, we won't know if more.
No, that's really well put. That's a really good point. Thank you for pointing that out. So finding those ways and those different community indicators, I think of the work that we're doing at Oasis and whether or not in prenatal drug screens we're seeing, positive use, and whether, what are those other areas in our community we can say, this is something we're trying to improve as a health outcome, and this is where it's gone now that we're embarking on this bold new plan. So if folks have ideas about that, this would be a great forum to kind of share them and see if we could put some energy towards really tracking it. I think that would be important. Any other thoughts about 110 before we move on our agenda? If you have speakers you'd like to hear from or sectors you'd like to hear from, let me know and we will invite them. We've had really good luck with attendance so far, so we will keep reaching out for our next meeting. All right. We do have community business today. We need to approve the minutes from November 18th. Are there any members here today who had a chance to read the minutes and would like to move that or make a motion or have a discussion?
I'll move to approve.
We have a motion to approve. Do we have a second?
I would second that.
Ron, I think Justin Hahn got in right before you.
Oh, good job, Justin. Way to third. I'll do third.
Have a third from Mr. Dunn. Thank you. All right. Jennifer, would you mind doing a roll call vote so we can get the minutes approved?
Sure. Okay. Jack Atkins, I believe, had an excused absence. Dora Best also had an excused absence. Ron Dunn?
Here and accounted for, in favor of.
Great, thank you. Eric Geyer?
Yes, in favor of the motion.
Justin Hahn?
Present and in favor.
Amanda Eisenhower? Thought I saw her.
Yes, sorry, I couldn't unmute. Yes, I am here and in favor.
Great. Rosemary Jernigan?
Did that work? Approve. Thank you.
Okay, thanks. Lisa McCready? Not sure if I saw her. Michael O'Malley? I think he had an excused absence as well. Heather Phil? Nick Wrighton?
Approve.
Sarah Smith?
Approve.
Great, thanks.
All right. Appreciate everybody voting on that piece. Next on the agenda, Jackson County updates. I'm not sure if Tanya or Dr. Shames could join us today. Still in the middle of our COVID response.
So Tanya actually ended up having to go home sick, but she said she didn't have any updates.
Okay.
And then, like you said, Dr. Shames is in the throes of COVID stuff. So.
Absolutely. All right. Well, that takes us down to our local treatment provider updates. I think we're starting at the end of the alphabet today. So that means Reclaiming Lives Recovery Cafe gets to kick us off.
Hi, everyone. Good to see all of you, or some of you. We have returned to holding circles only in person. So cafe is still closed as far as serving food due to the restrictions on takeout only orders for the restaurant. So we have about 11 circles that meet every week, and those are taking place in our 5 conference rooms with distancing. All of those are under 10 people. So it's been a challenge to go Zoom, not Zoom, in person, not in person, but we're we're doing what we can. So we also are excited to announce that the podcast link will be available on Monday. We'll send it to Jennifer to send out to the committee, and we have 3 episodes. The first one is Brandon and Christy's story, a little bit of details involved, but what led to, their addiction, then prison, and then their recovery. And then episode 2 is Leading by Example, which is awesome to hear who mentored them and how they're mentoring others. And then the 3rd episode is about peer support and working in the field based on your lived experience. And I'm just really proud of our team for how that's all come together, and appreciate the fact that we were able to use CARES money to move that forward statewide. So I'm a little excited. It's a bit like having a baby. Like, is everyone going to think it's ugly or cute? I don't know.
Are we going to think it's ugly or cute?
I think it's amazing, but I love my people.
Love it.
Yeah, it's really cool just to hear their perspective on recovery. And I think, the lessons that they've learned in a really casual, fun atmosphere. So I'm excited to have you all be a part of that. Let's see, we also have new space in downtown Medford that we have ordered furniture for, and that's under construction. So we will have an entrance that's street side. Right now we're in conference rooms upstairs from Rogue Organic Cafe. So we're enlarging our space by 1,600 square feet. And with Brandon and I and Christy working in pretty small areas, different days of the week, but being able to have those additional conference rooms to serve people, if it makes sense, like we're taking our large space and making it smaller for COVID in a way, but we're excited to have that signage and street side location downtown. So Brandon has engaged with 3 people coming directly out of prison in the last week, and he has 2 appointments next week. So we continue to pursue those people who are incarcerated and are coming out. So a number of people are getting released early. Kate Brown's moving them out. So we're taking them on and excited to help them connect with resources, and our partners, as usual, have been amazing in helping us do that. Number of people who have been really solid are struggling with relapse. I hate to bring that up again, but it is really crazy out there with the holidays and just the uncertainty around how long COVID will last, and access to just different treatment being a wait, and I don't know, just challenging times. This weather is not helping either. So we're doing everything we can to engage people on social media. And Brandon and Christy, all of us make phone calls every single day and are texting our people and just trying to keep them engaged in positive ways. And we have oriented a lot of new people lately. So if you have people you want to refer to us, please give them our number and we'll set up an appointment for a one-on-one to get them to fill out the paperwork to be at Recovery Cafe and in a circle as soon as possible. So that's kind of where we're at.
You know, another thing I want to point out is it's incredible that even through COVID, through the prison systems, our name is even getting out there and that we're getting phone calls and people are reaching out to us for help. It's outstanding. I'm really proud of the work we're doing here and I'm just really excited to keep it going. I'm glad that we were able to find motivation through all the COVID distress, but we are still moving forward and we're not stopping. I'm super happy with the work we're doing and everybody else in our community. So I want to thank you guys firsthand for walking alongside us and helping us along our way. Thank you.
And Christy's working with a number of people who are wanting to enroll at RCC, SOU, and in different trades. And so we're still on that governor's committee to see if we can be a part of the rollout for Redeeming Scholars, which is people formerly incarcerated or those coming out of incarceration to be assigned a peer support person to help them engage in higher education. So those are all places that we're, kind of putting our efforts towards, and we'll continue to do that in the new year, along with all of the work around Recovery Cafe and holding those people in our space and being able to support them with connections with people of like mind and, positive influence. So thanks for all of the referrals and the support you guys have given us. Appreciate it.
Thank you, guys.
All right. Thank you, guys. Appreciate that. Phoenix Counseling, I don't see John Bohm. So I don't think Phoenix is here today. But Eddie, as we get to On Track, I see that Alan Ledford's with us, and I believe this may be getting close to when Dr. Ledford is transitioning to his next chapter. Am I right? Or?
Yeah. I thought I'd come today to sort of tell all of you people how much I just absolutely hate you and hope I never see you again in my whole life. Okay. Stacy's laughing. She's going, you all think he's joking, but
actually I said you idiot out loud in my office.
You idiot?
Yeah.
Well, I think I'm pretty good at not burning my bridges. So I thought I'd take the opportunity for two reasons. One is, yes, I am leaving at the end of the month. I'm gonna be in semi-retirement. I'm gonna go back to doing what I was trained to do, be a clinical psychologist, testing and seeing clients and doing some, hopefully, training and supervision and those consulting, that kind of work. If somebody offered me a position at this point doing some kind of administrative work, I don't know if I would probably politely turn them down. But in my mind, I'd be saying, what are you, nuts? I'm never doing that again, which, is partly a function of age. But also, we got notification yesterday from CARF that we were credited for 3 years. So we've reached accreditation. The interesting thing about that is the surveyors said when they were there that it is almost unheard of for an organization in their first go around to get accredited. And it is unique if you do to get accredited beyond provisional or first year. I know that there are folks who've done that, but it has been a struggle for the last 3 years to get us on that path. And when I came, I think you all remember, those of you who were sitting on this council, that I said that was our goal, because we can talk all we want about how much better we are. You can see it, but to have an outside organization that has no investment in what we do, come in and look at our organization and have the kind of comments they had to us about the quality of care and the quality of the organization really says something about the work that we've done in the last 3 years. And I know that On Track was, to put it lightly, was a bit of a mess when I got there. It is no longer that organization, and I think this just simply stamps it for us. I didn't know if it would happen before I left or not. I was hoping, but you know, it was. Somebody told me today that they wrote down, actually took a picture of the 9 things I wrote on the board to do before I left, and they're all done. So I feel good about leaving. I'll see clients, probably the really underserved population in this community for addiction is those who have Medicare, because there aren't Medicare providers. So I am a Medicare provider. I was in California. I got credentialed here. They dropped me when I moved to Oregon. They said, you don't live in our region, so you're out. But it was easy enough to get it back. So I'll serve some of that population and see what comes up, and mostly find some. I rented an office because I don't think my wife wants me to sit home all day. So, and yes, Stacy, I can be an idiot, absolutely.
Hey, Alan, it's Dana Peterson. Just want to say good luck on your new endeavor, and it was a pleasure working with you.
Thanks, Dana. Same to you.
I just wanted to say, Alan, I say that with the greatest amount of affection when I call you an idiot. But I do appreciate all the hard work you've put in and your consistency in coming to this meeting and being able to just be honest and tell us where you're at and where your agency's at. And congratulations to you. I know that CARF certification was a big thing for you, of something you've wanted to do. So I will miss you, and I wish you the best.
Thanks, Stacy.
And Alan, you were always gracious and giving to your partners, but you were unwavering in your commitment to organizational excellence and making sure that the ducks were in a row. And our Valley is tremendously better off because of your work. So thank you so much for what you've done over the past 3 years.
I appreciate that, Eric. Thanks.
Eddie, is there anything you want to share after that? I mean, come on. You good? I will take that as a good. All right.
I'm good. Yes. We had a really nice party, sort of holiday, sort of for Alan, and we had a blast. It was hard to keep a surprise, but we did. And I should show a picture of the guitar-shaped cake that we got made, but it's all been eaten. But it was really good. So
that's great to hear.
Yeah, love this group of people, and so glad we're a part of it.
Awesome. All right, Oasis. Let's see. I'm not sure if Kristen was here, but did we have somebody else from Oasis that could? Okay.
Yes, I am here.
Renee Dodge was on.
Oh, Renee. Yeah. Nice. Renee. Yours today. Thank you.
Hi, everybody. So Oasis is just crazy busy. We have definitely been seeing a lot of relapse going on out there. You know, COVID, the holidays, everything. Dr. Hecox is just running like crazy here. We're really still trying to build our pregnancy program, which has really started to kick off pretty well, actually. We're getting a lot of pregnant mamas in here, but keeping them engaged out of treatment, to get into treatment has been a really big struggle, but we're just really pushing forward and keeping at it. So no other updates than that.
Well, I appreciate all of your updates, and I know confidentiality and protected health information, but if you could just show like baby videos when you come in, maybe we'll make that part of our official meeting.
Yes, I love that story.
So really always inspired by your work. Thank you for sharing that. All right. Medford Treatment Center. It's been about a month ago that I got to tour, that Kyle Gray gave me a tour of it. It was beautiful. It was clean. It was professional. It was trauma-informed and accessible. Kyle gave me an email back asking me about 3 things. And at the end of that email, he said, "Go Ducks." I have not responded to those 3 things, Kyle. I'm sorry. And the Ducks, since you sent that email, have not gone well. So I'll see what I can do to remedy my part of it. But welcome. Thanks.
Well, the Ducks got a big game on Friday, so I still have my hopes up. So
championship caliber team, we earned it.
Right, we got there. That's all that matters. So things at Medford Treatment Center they're moving along. As we approach our 90 days open, our 90th day will be on Monday. We actually just secured additional space in the building next door, the upstairs. So we have some additional space there. It's been difficult navigating COVID, as we typically see over 100 clients a day that walk through our doors in our roughly 4 hours open. It's tough with a smaller lobby to try and keep employees and clients safe, but we're navigating that as best we can. One of our big things that we're doing right now is we've actually started doing client satisfaction surveys. We do that at our other facilities once a year. So we're actually getting feedback from our clients in a survey that we created via SurveyMonkey. We get those results back at the beginning of the year, and then we kind of review that and see what areas we can improve on. But things are going good. We're growing exponentially. We're serving clients that need us, and I'm really proud of my staff. And I'm happy for this additional space that we've secured, so that we can continue to serve more people as we need. So that's what we've been doing.
Appreciate the update, Kyle, and glad you guys got your feet beneath you and you're moving forward. It's exciting. Julia, did Julia get to join us today from Max's Mission?
Yes, I am here.
Oh, awesome. Great. Thanks.
So good to be here. So we will be in Alba Park tomorrow with a naloxone event. Training and free naloxone could be in the gazebo if it keeps on raining like this, but we will be there from 2:30 to 5. We continue to service our boxes throughout Jackson and Josephine County, expanding them in Josephine County to Wolf Creek and to On Tracks building in Cave Junction, which they have just purchased. So we're excited about that. I was talking to the fire chief in Wolf Creek this morning, and there was an overdose death 2 weeks ago from a 39-year-old. So we're keen to get as much naloxone out there at this time of year. We know there's often a red alert around Christmas. And so if people need to reach out to us, other agencies, please feel free to do that. And we are happy to put on another event if needs be between Christmas and New Year or whatever happens. So open to input there. And continuing to work with the OHA on the harm reduction clearinghouse that is open, and I think they have spent all the money so far this year, but it will reopen in January with more funds for naloxone and PPE and other harm reduction equipment.
Good luck on the weather this weekend, Julia, and it's sobering to hear, but it's also neat to see the number of boxes you've been able to put out through our community and just what that does to access. And so really impressed with that work. Thank you.
Thank you.
Sarah, you're on for a La Clinica update.
I am. So for people who might want to get treatment for opiate use disorder in primary care, that would be something in particular that La Clinica could offer. We have 18 ex-waivered providers. 3 of those are midwives. It takes right now about 1 to 2 weeks to get in. It has to do with holidays and whether the person requesting care wants to go to a specific site or not. It might take a little longer to get them in. We're doing hybrid care in person and telehealth. We have 3 providers doing groups, and they're mostly virtual. We are cooperating, as I understand it, with Medford Treatment Center and Allied, so that if someone needs help right away, that is where they need to go. But we can cooperate so that they can get into primary care and not have them have to start the clock over again to get into care. And I think that's it.
Thank you. I appreciate that update as always, Sarah. Cynthia Copia, right there in the middle. Thanks.
Hi. I do not have any new updates. I'm just plugging along, and things are going okay as well as they can be going right now. And yeah. So.
Did we get an official update from you on Medford, or did I get like an email update?
I think you got an email update. And so, Medford was opened and is fully functional. And with the, the recent, stay at home and lockdowns and things like that, and we sent all of our clinicians that were in the office back to work from home. So yes, Medford's up and fully running and functional. And also I just kind of have my staff concentrated in the Ashland office for right now, until things simmer down a little bit, with the COVID stuff. So yes.
Gotcha. All right.
But we had a successful soft opening.
Definitely. I think anybody just being able to stand up and move forward within this COVID environment is just inspiring. So it's great to see pieces still in place. So Dane Zonner from HIV Alliance, were you able to join us today? Justin from Boulder. Justin, it looks like your name is Justin S. Boulder, which is a very punk rock kind of name. I kind of like that, but any updates on Boulder Care?
We could start a band.
Right. Man.
or at least a label.
Okay.
Hey, everybody. Good to see y'all. We have recently started working with Regions, which is awesome. We have a partnership with them as well. We are, working with the Jackson County Community Justice Center, serving some of those individuals, and moving forward in terms of Measure 110, Boulder's stance on it is that, we believe that telemedicine, is definitely part of how Oregonians will be able to get care. And we hope to be, continue to be part of that discussion, because we think it's, we know it works, and we want to help however we can. So other than that, no other updates.
Well, and Justin, just to give an anecdotal story, I mean, I don't want to make this an age thing, but, I started work 23 years ago, and when you wanted somebody to get help, sometimes you'd have to go to a clinic, sit in like an emergency care room, maybe they would get seen. And the idea of somebody who was suffering with substance use disorder and maybe going through withdrawal, being able to do that and get help, it was just really improbable. So now the fact that we have people who are serving out a short sanction out of the transition center that can connect with your agency with a real person, can get medical attention, and then have access to medicine, it's just incredible. I mean, it just shows how far we've come. And I really am so appreciative of you. And we'll have you and maybe some of the team come and talk about what that program looks like. But I think that, even within Measure 110, there's still going to be folks with substance use disorder who are in the criminal justice system, and to use short-term sanctions and incarceration stays as an opportunity for a person to pause, get clear, get health, that's really still going to be a big role in people's lives. And so thank you for being so dang responsive.
Absolutely. Thank you.
Yeah. Let's see. Jody from Allied, was Jody here today? Okay, I have Kim from ARC, but Lori, if you want to take the ARC, yeah.
Yeah, Kim couldn't be here today, but in addition to seeing how DATRA rolls out and what the impacts of that will be, we're anxious to see. We're also still working on planning for the rollout of Heart Village, which is a tiny house village that we're doing in partnership with Rogue Retreat. and it will have the capacity for anywhere from 12 to 24 people at any one time. And we're excited to see that. Next step is meeting with City of Medford planning in January. So. Oh, and most important, sorry, is Alan Ledford. We gave him a bad time at our providers meeting this week a little bit. And, but what I want to say in seriousness, Alan, is that I will miss you. I have absolute respect for you. You not only climbed the mountain, but what you achieved this week is fantastic. And thank you for your contribution in our community. It's huge.
Thanks, Lori. Hopefully my contribution to people won't stop, but you never know. I am fairly self-centered, so.
All right. Thank you, Lori. Did I skip over? No, I think we're at CCO updates. And so Jeffrey Piacitelli, I don't know if Jeffrey's here. Still, Jeffrey, thank you. I see you right there. With
Yes, hi, Eric.
Yeah.
I'm here. Hi. Hi. No real updates, Eric. I mean, we've had a little bit of a lull in substance use disorder presentations in Jackson, but we've had a bit of an explosion of substance use ED presentations in Josephine. So, it continues to come fast and furious. And I think as people have expressed earlier in the call, we have the holidays, we have COVID, we have the weather turning. I mean, there's just a lot of contributing factors. So other than that, I mean, we've seen an uptick in people presenting with substance use disorder issues in hospitals way far from here, in particular Arizona, Florida, Texas, Tennessee. So people are on the move, but they're the things they wrestle with are following them. So it's been an unusually large number of folks presenting out of area right now. That's really all I have.
No, I got you. I always appreciate that because it's one of those perspectives that I don't always carry with me as to where substance use disorder kind of pops up within our community, and hospital presentations and some of those really acute problems are really important to keep into that perspective. So thank you.
You're welcome.
Darren or Julia Jackson, Darren Dale, Julia Jackson with Jack's Care. I know they had to go. Sounds like they couldn't make it or stay. But we have Dana as well as I think Sam was here earlier too from the Oregon Health Authority. So if we kick it down to OHA, do you guys have updates as well? Maybe not. All right. We can come back to Oregon Health Authority if they have time. In the meantime, Oregon recovers. Sarah with the OPNWG, so Oregon Pain Guidance Naloxone Work Group. I got it. Okay.
And after all that, I really have nothing to add this month.
Fair enough. We have added Dr. Adam Trotta about Southern Oregon MAT community. And Dr. Trotta, if you are still with us, and I haven't been able to tell on all of that, he might have had to jump off there.
Susan is here though.
Susan is good. Yeah, Susan Sanchez. If you wouldn't mind giving us an update on what's been going on and how that group's been doing.
So we are not serving patients at Stuart Meadows any longer. That's been put on hold, but I do appreciate our community partners stepping up and taking over the care of those patients while we had to switch gears. And Dr. Trotta is kind of figuring out his new role in the community, but he remains very passionate about treating substance use disorders. And so we will see him in a new role soon, I think. And at Providence, we're still committed to the connecting people to help. We're got our hands in all kinds of pots trying to figure that out. So thank you.
Well,
hey, Susan, could you explain a little more about this, the Southern Oregon MAT community and like who's involved and what you've been doing?
Well, back when COVID started, we started a Zoom meeting to try to just support people. The rules were changing around prescribing and in clinic visits and televisits and just all the different rules. So we started a little group meeting and we're just trying to support each other. And it kind of grew into like community support group because it's hard work and it's hard to figure it all out. Right now, I think there are a few providers who are working on a community call service that could serve both hospitals. There's still a few details being worked out on that so that we would have better responsiveness to patients who were in the hospital needing bridge prescriptions until they could connect with the provider longer term. But this COVID has been really hurt this community of patients. I feel like a lot of folks are falling through the cracks. Really looking forward to the new year when we can capture them and connect them and get things at the ARC back in person and on track. So I'm not sure what else. Is there something specific, Sarah, that were wondering about?
Not necessarily. I think it's just been a really vital group to support the buprenorphine prescriber, community and not letting things drop. And I know a couple meetings I've attended, you had some really good provider education. It's kept to just 1 hour at the lunch hour once a month. So that seems kind of provider friendly to me. I've just been really impressed with your work. So.
Thank you very much. The group is meeting again on the 22nd. And if anyone would like to attend that group, you can send me an email and I'll get you on the invite list. It has turned into it. There's some education. It's kind of a hodgepodge of things, but the biggest piece is there's a lot of support there, and this works really hard. So send me an email if you would like to be included in that meeting.
Well, Susan, we've been all big fans of your work, and it really is impressive what you've been able to pull together and what that community what that's meant for our community, having that kind of a resource as providers who are either new to that kind of prescribing work or are old hats at it. Just having that there, I think, really helps the overall cause and mission. So thank you. So that brings us to closing thoughts, and I just want to thank this group again. I think it is indicative of the amount of people who have invested in this group that the Director of Behavioral Health for the state of Oregon would want to come and at least just say, hey, this is where we're at or what we're thinking. The more you look at the leadership within this group, the people doing the work, the people moving the work, very grateful for it. We'll continue to have discussions around Measure 110, this bold new movement that our state is engaged in. And whenever I have fears and concerns and start to freak out, honestly, it's groups like this that make me think there are some really passionate and intelligent folks putting their thoughts to how we can go forward within this new environment. So with that said, we will get back together in the new year, and I appreciate all your work. Thank you, guys.